Welcome, those who are just joining us. Feel free to introduce yourself in the chat and let us know where you're calling from, and we'll get started in just a minute. It's great to see we have people from Florida, Rhode Island, South Carolina, Illinois, American Samoa, Michigan, Nevada. Great to see folks from all over. And shout out to the person from American Samoa, because I understand that it's the middle of the night there. So thank you very much for joining us. Okay, let's go ahead and get started. Hi, everybody. It's my pleasure on behalf of the Office of Child Care National Center on After-School and Summer Enrichment, or NCASE, to welcome you to today's webinar, Workforce Supports for Promoting Mental Health and Well-Being in Out-of-School Time Childcare. I'm Siobhan Braden, and as part of Truth and Reconciliation, I would like to acknowledge that I am participating from Cambridge, Massachusetts, which is located on the unceded lands of the Pawtucket and Massachusetts people who continue to live and thrive in this area. As you join, feel free to introduce yourself in the chat and let us know where you're calling from. It's wonderful to see participants from all across the country. Many of you are likely familiar with NCASE, but for those that aren't, NCASE is part of a national training and technical assistance system funded by the Administration for Children and Families Child Care and Development Fund, or CCDF, administered by the Office of Child Care under the U.S. Department of Health and Human Services. This network of national centers supports states, territories, and tribes in implementing CCDF to provide low-income families who are working or participating in education with help paying for childcare. I'm joined today by my NCASE colleagues, Bianca Reed and Mary Colleton. And we're pleased to welcome Diana Toulier from our Sibling Technical Assistance Center, Preschool Development Grant, or PDG B5. While we'll be focusing on supports for the out-of-school time workforce, Diana will share some trends that she's seeing on her work with states in the early childhood area. We'd like to start out by hearing how you're feeling today. So feel free to enter in the chat the number or numbers that apply to how you're feeling. Okay, we're getting quite a few fours to fives. Okay, we've got some twos, some threes, a real mixture. I think thus far, 4 is the most popular. Great, thanks for taking time to do that. Here's our agenda for today. We're going to do some polls to get to know a bit more about who's joining us. We'll provide an overview of the topic. We'll focus on specific areas of workforce support, including to support mental health and out-of-school time, including collaboration and expanding access to training and coaching. We'll have an interactive discussion. We'll share some resources, and then we'll request your feedback. So Mary, can you please start our poll? Okay, so we have 3 questions for you. So if you could please scroll down as you're completing them. One is, what is your role? One is, if you selected none of the above, we ask you to try to categorize yourself. And then the other is, what's your level of knowledge or awareness on workforce supports for promoting mental health and well-being in out-of-school time? So we'll just give folks another minute to complete it. I see we've got a lot of responses coming in. It's great to see that we have a real range of folks participating. Okay, Mary, can you go ahead and close the poll and show us the results? Okay, great. So we have a number of folks who are state or territory CCDF lead agency staff. We have folks from state education agencies, licensing agencies, tribal CCDF lead agencies, some folks from Office of Child Care, TA providers, School Age Network, CCR&Rs, program providers, family child care. Wow. So we have quite a range. And the knowledge or awareness on workforce supports, the largest number of people said moderately aware. And then we have some folks saying minimally aware, not at all aware, or very aware. Thanks. So I'm going to pass it over to Bianca now to get us started with the content of our session.
Thank you,
Bianca?
Siobhan. Thank you. Excuse me. Hi, everyone. Thank you so much for taking the time to join us today. No matter where you are, we greatly appreciate your time and attention. So today's webinar, which focuses on Strategy 3 in the May 9th Office of Child Care Information Memorandum, also known as the IM, it aims to inform and guide you on using the Child Care and Development Fund to promote mental health and well-being of children, families, and the child care workforce. We will discuss how to build skills and knowledge in the child care workforce related to children's mental health and adult behavioral health throughout training and through professional development. Now, this IM is a crucial guide to CCDF, Child Care and Development Fund lead agencies. It outlines how CCDF funds can effectively improve children's mental health, well-being, families, and early care and education workers. So the entire community that we support. While not introducing changes to the Office of Child Care's existing interpretation of how CCDF funds can be used, this IM provides clear and comprehensive guidance on allowable uses for supporting mental health, and understanding your role in this critical endeavor. So let's talk about some of the things that the IM supports. The IM provides examples of mental health supports and strategies, including but not limited to building skills and knowledge in the workforce, promoting healthy child development and healthy environments, increasing workforce wellness, and increasing access to behavioral health and supports. Now, according to the CDC, mental health is a broad concept that encompasses emotional, psychological, and social well-being. It influences our thoughts, feelings, and actions and plays a crucial role in handling stress, relating to others, and making healthy choices. This comprehensive definition underscores the complexity and importance of mental health in our lives. Now, in continuing talking about mental health, we want to be mindful that it's not just a topic of discussion, but an essential aspect at every stage of life, from childhood to adolescence throughout adulthood. This underscores the urgency and significance of our collective efforts in promoting mental health and well-being, a task that cannot be delayed or underestimated. So in talking about the importance of this, I want to move forward in discussing our peer learning group. Throughout this webinar, we will share the remarkable strategies from the action plans developed by cross-sector teams from 9 states across the nation. These teams, who recently completed a 6-month in-case peer learning group on this topic, have not only shown an exceptional commitment and dedication, but have also significantly built and strengthened systems and supports for mental health and well-being in out-of-school time. Their achievements, which have had a profound impact, are genuinely inspiring and serve as a testament to the potential impact of our collective efforts. We sincerely thank them for their invaluable contributions, which are instrumental into our shared mission. As noted above, the action plans focused on building skills and knowledge in childcare workforce related to children's mental health and adult behavioral health throughout training and professional development. Your role in implementing these strategies is crucial, and we value your contribution to this process. We also want to acknowledge two additional buckets that were addressed in the PLG, and that is the collaboration to increase professional development opportunities and expanding access to training and coaching. So all very valuable topics. So we're going to point our attention to right now the collaboration to increase professional development opportunities. We'll focus on collaboration to increase these opportunities. Many state action plans focused on collaboration, both across members of cross-sector PLG teams and with other agencies and organizations. And they collaborated to strengthen the systems that support the workforce around mental health. So let's talk about some successful cross-system collaboration. There is a focus on the potential of cross-sector collaboration in OST to make the most of our resources, help with sustainability, and raise the visibility and importance of OST. The Forum for Youth Investment captured the importance of collaboration in this brief that shared a high-level list of 5 tenets of successful cross-sector collaboration. They include having a shared vision and goal, making sure that we are identifying jointly the population to be served, and acknowledging the issues and target areas of concern that need to be addressed, and of course, the desired outcome. Secondly, we want to make sure that we are including multiple perspectives and voices. This is super important. Those directly impacted by the collaborating systems are experts in their own experiences and can provide a nuanced understanding of the impact of policies and practices that many data systems fail to capture. Additionally, communicating clearly and regularly using inclusive wording is incredibly important. Establish clear notes and responsibilities, use a shared management tools, accessible minutes, and written decision-making and conflict resolution agreements. So just making sure that everything is clear amongst teams. Additionally, we want to make sure that we are creating buy-in at all levels, including those who may not be at the table, including those receiving certain services or managing services. And then last but not least, we want to make sure that we are measuring impact. So measure impact, being sure to consider equity so that you know how everyone is experiencing these changes. And this includes collecting information on critical activities defined by an agreed upon metrics, evaluation, and learning by reflecting on information gathered. So these were some really important collaboration resources that we just wanted to share and thought were incredibly successful within our PLG. So moving forward, we're going to talk about the collaboration continuum. This is a helpful collaboration continuum to consider when partnering to achieve shared goals. The main idea is that as trust increases, we can move from networking that involves sharing information to coordinating and cooperating, where we change services, share resources, and collaborate, where we can identify shared funding, possibly merging system structures as well. It's developmental, which does not mean that things are always moving in a straightforward line. As you can see, different partnerships may be at other places, and this may look different over time as people come and go. So it will definitely take a significant effort to make these collaborations effective and strong as well. Additionally, I want to talk about braiding, blending, and layering. Braiding, blending, and layering funds can help increase OST access and quality. These strategies can also help with sustainability so that a program or service does not solely rely on just one source of funding, excuse me. So with braiding, funds from multiple sources support the total cost of a common goal. Funds from each source must be tackled separately to avoid duplicate funding. Then administrative costs are shared proportionately with each funding stream. Blending, on the other hand, allows funding streams to be mixed and not allocated or tracked separately. This approach is more accessible and less burdensome administratively, but reporting requirements make it challenging for federal funding. It can be easier if funding is private and flexible, so something to be incredibly mindful of. Last but not least, with layering, typically there is a foundational layer for funds for the core services that is supplemented by additional layers. In OST, the foundation could be parent fees or family fees, CCDF subsidies, or 21st century CCLC, and additional funding that may cover staff training and coaching, mental health supports, or other essential initiatives. So, and now at this time, I'd like for us to hear from Diana about trends she is seeing around collaboration to support PD systems in early childhood.
Thanks
Diana?
so much, Bianca. That was a really great explanation of braiding, blending, and layering. That is always still confusing to me, and you simplified it so well. So thanks for that. So since the PDG grant is a systems building grant, states are encouraged to combine funding from multiple sources in the best ways that work for them. So as you can imagine, there's a lot of collaboration already with CCDF. There was a lot of collaboration when states were receiving ARPA funds, just different funding streams. We encourage states specific to mental health to partner with folks that are receiving SAMHSA dollars or folks that have mental health block grants. And then we have states that are integrating infant early childhood mental health into their ECCS grants and into their ESEDS data collection. So lots going on around really trying to figure that part out. But I also want to talk about, we have a lot of grantees that are working on messaging so that everyone has a more consistent, better understanding of what infant early childhood mental health is. Some are focused on communicating that to other state level agencies, and some are committed to spreading information all the way to families by embedding it in their parent engagement strategies. One trend that we're seeing right now is a lot of states are using the Alliance for the Advancement of Mental Health Pathways for endorsement to increase the number of providers who can provide mental health consultation to both other providers and to families. That endorsement has 4 different levels based on demonstration of different competencies for each level. And the great thing about this endorsement is that it provides consistency so that once someone is endorsed, no matter what state they go to provide services, you know that they've met a certain set of competencies. The Alliance is also in the process of developing a set of mental health competencies that states can use. They may be able to incorporate those into their early learning standards or things like that. And they don't necessarily have to have endorsement in their state. They won't have to have endorsement in their state to be able to access those competencies. There are also some states who have developed their own certification guidelines for mental health consultants. So we've seen that in a couple of states. A lot of states are working with the Pyramid Model Consortium and the National Center for Pyramid Model Innovation to expand those practices that they learn statewide, or even just to expand those to underserved populations, specifically like family child cares. States that have existing statewide consultation provided by mental health agencies are working to expand their applicant pool to other providers by asking them to have specific experience, or maybe they have experience working with certain target populations. PDG grantees are also partnering with other state level agencies like child welfare to increase providers who can provide consultation. And that's actually one of the recommendations that's in the PDGB-5 Mental Health Information Memorandum. I know you guys are talking about the one that is specific to you all, but there's also another one that's specific to PDG. And I'm sure there's a lot of overlapping information and resources in both of those IMs. States are also developing core competencies for early childhood professionals and embedding them in career pathways. And we actually have a state that that has blended age mental health consultants because there was such a need for mental health consultation in the 6 to 12-year-old population. So they are piloting that, and I think that's going really well. And another thing I think that we're seeing a lot of is mental health consultation being provided both on-site and virtually, since there is such a high demand for services.
Thanks so much, Diana. It's great to hear about some different trends in early childhood and also a lot of similarities. And of course, part of the work that we're all doing as national TA centers at the system level is to try to connect early childhood and school age systems. So certainly in our peer learning group, although we didn't focus on it today, there was a lot of discussion of mental health consultation for children and for the workforce. So exciting to hear about that. And thank you for sharing those trends with us.
Sure.
These are the resources that were just shared, Bianca just shared. And you'll have these in the slide deck when it's sent out to you. But just wanted to let you know, call them out here for you. The Act for Youth Center of Excellence, which was that model that we looked at, the Forum for Youth Investment with the 5 tenets, and then the Office of the Assistant Secretary for Planning and Evaluation with HHS braiding federal funding. And now we'd like to hear from you again. So Mary, can you please launch our next poll? And this question is, how would you rate the level of collaboration in your state, territory, or tribe around workforce support for promoting mental health and well-being and out-of-school time across different sectors and organizations? That's a long question. So I see folks are jumping in with their answers. Okay, let's give it another 30 seconds, Mary, and then we can close the poll and take a look at the results together. Okay, great. So the largest group selected medium level of collaboration, so that's great. Next after that was low, and then high, and then very low, and then last came very high. So a mix. Good to see a large number of folks answering in the medium range, because as we all know, these collaborations are so important when we're doing systems work. So now I'm going to pass it back to Bianca to dive into our next content area that surfaced as a strong area in action plans with our peer learning group.
Absolutely, Siobhan. We're going to be focusing on expanding access to training and coaching. This area focuses specifically on our OST workforce around mental health, as many state action plans prioritized these topics. So in moving forward, one of the things that we wanted to acknowledge is that we wanted to have a goal of elevating innovation and equity to strengthen the OST workforce. When we think about supporting our providers, the big picture is that we must ensure that OST jobs are good. We want to make sure that people enjoy where they work and that the workforce is well supported by finding ways to improve all three overlapping strategies: compensation, preparation, and work environment. A well-supported workforce means we can recruit and retain motivated staff so programs can stay fully enrolled and staff teams have the sustainability and stability, needed to focus on quality improvement, leading to positive youth outcomes. This requires funding that supports carefully thought out orientations, ongoing professional development opportunities, as well as coaching and wellness support. Next, one of the things that we want to acknowledge is our social emotional learning, PQA, preparing staff to use tools. Many states have developed their own school-age programs, quality standards, which is great. One of the tools most states are familiar with for quality assessment tools is the Wickard Program Quality Assessment. In 2019, they published the SEL-PQA. So again, that is the Program Quality Assessment. After refinement with a team of researchers and youth development practitioners, this was built on prior tools, the Youth PQA and the School PQA. The SEL-PQA focuses on creating safe and supportive environments that provide coaching about emotions, fostering a growth mindset, and creating an interactive and engaging environment that cultivates empathy, encourages teamwork, and supports youth interest in increasing learning motivation. Additionally, we want to be mindful about coaching for quality in OST. Coaching is one of the most effective ways to support staff and improve program quality. With its focus on relationships, strength-based practices, communication, and coaching strategies like reflective practices and building leadership capacity, this guide could benefit program leaders in any stage of development. It also includes a questionnaire to check readiness for change and a coaching core competencies assessment tool. Keep in mind that some states provide professional development credits for participating in coaching. So that is one incentive to be mindful of. Now we're going to turn it back to Diana to talk about some of the trends she is seeing around professional development and coaching in early childhood. Diana?
Thanks, Bianca. So grantees are developing and improving their workforce registries for early childhood professionals so that they'll be able to track professional development, access trainings and PD, as well as connect to coaching and mentorship. States are developing their own statewide early childhood consultation models. Some focus on providing services in specific areas of the state, like underserved areas, and some are working on expansion in mixed delivery settings. I'm glad that you mentioned reflective practice and reflective supervision because that's definitely something that we are seeing a lot of states really grasp the ideas of. They're learning about the benefits of not only having staff trained to provide reflective supervision, but also being able to receive reflective supervision themselves. And we think that that's really helping with staff well-being. States are embedding pyramid models statewide, like I think I briefly mentioned earlier, for providers, and they're providing intensive training and coaching for providers who serve children birth to 5. Trauma-informed care training is also something that we are definitely seeing a lot of being provided to educators, practitioners, and even caregivers in states and territories. We have a few states that have partnered with higher ed institutions to create undergraduate and graduate level certifications in infant early childhood mental health. We have states who match providers with consultants, mental health consultants, for time periods of like 6 to 9 months, and they provide coaching to support the mental health and social emotional development of the children in their care. So the providers are actually receiving consultation and coaching from the mental health consultants. And then we also have a state-led infant early childhood mental health community of practice, where states come together quarterly to share ideas, discuss challenges, and propose solutions. And there's not really any federal oversight with that community of practice. Our TA center is not very involved in it either. So it's a really great opportunity for states to come together and just be able to really share their challenges and solutions and really talk about, what's working and what's not in their state. So we've heard a lot of really good positive feedback about that.
Thank you so much again, Diana, for sharing those trends. Again, a lot of overlap and some differences. And just to build on what Bianca shared about coaching, the focus on coaching was so resonated so much with participants in our peer learning group that we actually ended up offering 2 special sessions on coaching, meaning that folks participated in 8 sessions instead of 6. So absolutely a strong focus on that. And also interesting to hear about the community of practice. Diana, I think we all know through our TA work that peer learning is so valuable, and opportunities to find out what others are doing, whether in a formal or informal setting, is fantastic. So exciting to hear about that. These are the resources that we shared in this section. So you'll have these after the event. And now we like to hear from you using Padlet to have a discussion. I think somebody is going to put the Padlet link in the chat. And I will also put the questions in the chat in case for some reason you can't access the Padlet and you want to put your responses in the chat. And the questions are, how are you collaborating to support professional development opportunities? How are you offering or expanding access to training and coaching? And what resources are you using? And I think I need to stop sharing my screen so Preeti can share hers. And thanks, Mary's put the link to the Padlet there. And I'm also putting the questions in the chat. Folks just want to take a little time and respond. I know it's hard to see on the screen. You can use on your upper right, you should be able to expand your view so that you're just seeing the screen for this. But obviously, if you're in Padlet, you have a better view of it. So we'll give folks a couple minutes of not talking to start sharing.
And Siobhan, hi, this is Preeti. Can you share with us, for folks who might not be familiar with Padlet, how can they add a comment?
Oh, sure. That's right. I was supposed to do that. If there's a plus sign under each question, and if you click on the plus sign, you want to go ahead and do that? Is that you, Preeti? If you want to go ahead
Yes.
and click on it, yeah, you click on it, and then you should be able to type into it. And
So if you're seeing my
then,
screen in the lower corner, there's a box, I believe, and then you can add your comment.
Thank you. And then as Preeti's doing, you just click the publish button. And now we really are going to stop talking.
Shabazz, someone shared in the chat learning about the options, and I believe that is Denise Muldrow. Denise, if you would like to either put that in the Padlet or unmute to share a little bit more, we greatly appreciate to know a little bit more about your thoughts and your feedback. All right, and how are we looking with the Padlet, Siobhan? Are we having any responses yet? Ah, here we go. All right, I'm starting to see them.
I was talking on mute. Things are coming in, and also I saw in the chat a bit earlier that somebody mentioned, Heather mentioned that they have coaches in their Head Start program in Massachusetts. Great, good to hear. Thanks, Heather. Preeta, can you try refreshing the Padlet? Because sometimes the responses don't show up.
Sure can. I need a bit of TA
Yep,
on
go
how
to
to
the
do that.
go to the upper left-hand corner and click the little
Icon.
left hand,
My other left.
your other left up into the menu bar next to the URL and click that little circly arrow thing.
I love your descriptions. Thank you. It makes so much sense. Well, look at there. Thank you.
Thanks, Kate. So Bianca, should we start? Do you want to share out a couple things that you see? I'm actually
Absolutely.
gonna go to the Padlet so I can see it better because I can't really see that.
All right. So one of the questions that we have here is how are you collaborating to support professional development opportunities? And we got a lot of responses, including offering resources and recommendations tailored for individuals for free PD, utilizing our mental health consultant to provide trainings. They will be present at our prospective training with staff. I'd love to hear that, utilizing what you have already in-house. Benefiting from the offerings of Learn24 and passing them along to peers and coworkers. If possible, can whoever put in the chat a little bit more about what is Learn24? Would love to be able to share that resource with folks. We share all resources of trainings here in the center and focus on PD working within the community. I love to hear that. And also just again, working and partnering with folks who are doing the work with youth development providers, mental health professionals, and establishing a foundation to develop training curriculum on mental health and wellness. So I'm seeing a lot of great things around what folks are doing to support PD opportunities, whether it's collaborating with partners, identifying free resources, or utilizing your internal supports.
That's
And
fantastic. I see folks are putting a number of resources in there, and I also want to call something out from the chat, Bianca.
yes.
Abigail said that a few years ago, my program, North Carolina Pre-K, paid for us to take a professional development by conscious discipline, which really broke down the science behind emotions and emotional social development. Understanding mental health and emotional intelligence in myself allowed me to understand it in children. And it also taught us a lot of strategies and their effects on our options. Thanks so much, Abigail. That sounds like a really productive and thoughtful program.
Absolutely. Absolutely. Would you like me to move forward and talking about the next things on the Padlet?
That would be great because I've
right.
been responding to people in the chat.
Fantastic. So the next question that was in the Padlet stated, how are you offering or expanding access to training and coaching? This is a big one. A couple of things we see here. One that really stood out to me is burnout trainings for ECE providers. Would love to hear a little bit more about that, whoever put that in the Padlet. We also see here pyramid model modules, where they are getting ready to add a library of asynchronous models from the PMC. It is so wonderful to see all of you today. Whoever put that as the last note. Excuse me. Additionally, we see offering just genuine opportunities for folks to participate in those trainings, building your bounce. This person says that we are planning to offer the BYB training series this fall. We are offering an intro at our conference this summer. Building your bounce. Please tell us more in the chat if you can. Would love to know a little bit more about that. That sounds awesome. This is something our tribe is working to provide. Wonderful. There are also some instructional coaches that folks are aware of, and also just again emphasizing the importance of well-being in providers and staff, making sure that there is an entire investment from leadership right on down to team members. This can actually significantly help and expand opportunities for training and coaching.
Great, Bianca. I see folks have shared some resources in the Padlet, so I might jump in and just highlight a couple of them. The Unlocking the Center for Resilient Children, I believe, is also related to the Building Your Bounce work through Devereaux Center for Resilient Children. We actually had a speaker from that organization at our last year's Infant, Toddler, and School Age Institute, which was focused on mental health. I see mental health first aid as a resource. University of Chicago Foundations for Young Adult Success, and thank you for sharing these links. Flourish Agenda, creating strategies that allow young people to flourish. The pyramid model, absolutely, and Trauma Institute's community resiliency model. Harmony Academy, and we have the Science of Learning and Development, Design Principles for Community-Based Settings, and of course, CASTLE, which is a well-established social and emotional mental health organization advancing social and emotional learning. Great resource. So appreciate people sharing those links and sharing what you're doing.
Thank you so much. Do we have any other questions in the chat, Siobhan, that we want to take some time to address?
Well, Philip, thank you, Philip, asked a really giant question, which I don't think we can address in this webinar, which is how do I have to get to it. How do mental health concerns present in young children versus school-age children, and how approaches to support mental health vary between young children and school-age children? So those are big questions. I think we can share resources. I know Diana mentioned, well, actually, this is really more for this webinar is really more focused on the workforce. So we were all sharing strategies to support the workforce. But some of those resources are included in this presentation. So I think I don't see any other
questions. Oh, I do.
Okay.
Are there any examples of self-care trainings that emphasize staff well-being? Excuse me. And I believe, again, those can be referenced in a variety of resources that are available that I believe we can guide folks to. None that come to the top of my head. However, I would also encourage folks to ask their workforce, what is something that they would be interested? What are some of the things that they need for their self-care? And take some time to identify how, or if any trainings that you can find, how do they align with the needs of your workforce?
Great. And let's just leave it open for a couple minutes to see if anybody wants to respond in the chat specifically about examples of self-care trainings that emphasize staff well-being. and they may be in the Padlet already, but just with the person having called out that question, just give folks a couple minutes if they'd like to add something specific about that. And then we'll move on and wrap up our session today. We really appreciate everybody sharing. And it's great to hear about all the wonderful work that's happening all across the country, because we know you're all doing incredible work to support the workforce so that they can support children and families and also take care of themselves. Okay, why don't we move on with wrapping up our, Denise says, I have offered having a Zen room for both staff and children. And do you want to say a little more about what a Zen room is, Denise? Or, I mean, I would be happy to do it too. I'll give you a minute in case you want to speak up and say it or put it in the chat. A Zen room, as I understand it, is a peaceful, quiet place where people can go, and a calming area. Thank you. Yes, Denise. And we've heard about more and more out of school time programs using that. I have to say, we had mainly heard about it being an option for children, and it makes total sense to have that option for the workforce as well, right? So, and folks are saying in the chat that they love that. So, Preetay, can you stop sharing the Padlet, please? Great, thanks. Cozy corner for adults, another way to say it, right? Absolutely. We all need that, right? We all need a peaceful place sometimes. Colleagues, am I sharing the deck?
Yes, you are.
Thank you.
Yes, you are.
Okay, I thought I was sharing photos of London, but I'm not. Okay, great. Well, let's wrap up. So we just want to make you aware of our NCASE technical assistance and resources. We have a resource library, which includes many resources from across the OST world. So it includes NCASE resources, but also it includes resources from other organizations relevant to out of school time. And all of the resources that we've shared today are in that resource library. And then this one pager over here describes how we provide technical assistance and what kinds of supports we offer. And actually, I think, oh, sorry, I missed a slide. Okay, these are NCASE mental health resources that I do want to flag for you because we have a number of mental health resources. First, we have an e-learning module addressing adverse childhood experiences, or ACEs, in out-of-school environments. This is an e-learning module for which you can earn CEUs, and the link takes you to the Head Start website where you need to set up a free account, and then you can track your progress and get a certificate. We also have social and emotional learning and mental health and out of school time toolkit, support for systems and programs, which has a number of resources and state examples. And Bianca is the lead author on that. That's a super product. And then we have a webinar that showcased that. And then we have a newer product, which is focused on the workforce and providers, which is tips on social and emotional learning and mental health and out of school time. So I was supposed to do that first, and then let you know that that these resources are in our curated resource library. Now we'd really appreciate it if you could take a couple of minutes to give us feedback on this webinar. We're going to put the link in the chat, and we do have a couple of extra minutes. So if you have time to complete it now, we'd really appreciate it, because we do take your feedback seriously and it helps us plan for future webinars. And I think one of my colleagues has put that in the chat. Okay, has somebody put that in the chat?
Yes,
Yes,
the
it's there.
survey link is in there.
Thank you. And if you, again, we'd appreciate if you take a few minutes to complete it now. If we also will send a reminder email for it. And really want to thank you for your active participation today, for sharing all of the resources, examples, strategies. It's been a great opportunity for us to learn more and for your colleagues to learn more. And we will share the presentation and also the resources shared in a follow-up, and we'll let you know when the recording is available. So thank you for joining us. And here are some genuine after-school program photos from programs funded by the Child Care and Development Fund.